station, 90.3 WBHM Birmingham. I'm Andrew Yeager. Coronavirus may sicken people, but it's infecting many other parts of our lives. Colleges and universities have shut down, moving to online classes. A few states have completely closed K through 12 schools in an attempt to slow its spread. And the business world is reeling as well from the disruption the virus has and will continue to cause. Recession appears a distinct possibility. We're talking about the education and business implications for the rest of the hour. And still with us in the studios, doing a little bit of overtime, Dr. Mark Wilson, Jefferson County Health Officer. Thanks for sticking around.
Sure.
And then we also have UAB Business Professor Anthony Hood. Thank you for joining us.
No problem. Thank you.
And Dr. Wilson, let me turn to you because I want to start with the education questions. And we hinted at this a little bit earlier in the hour that you're not recommending closing schools. These are very complex decisions. But explain how you think through that decision, because after all, there are a lot of people gathered in that place.
Right. I will say that a lot of that decision does rest with the school board. And historically, with flu outbreaks, our local school superintendent or our state superintendent sometimes helps make those decisions, and they have a great deal of experience with this. They also have a great deal of experience and good standard practices in infection control because of flu outbreaks and other types of outbreaks schools have had. So we have a lot of comfort in that and the school's preparedness to handle these situations. As I said earlier, we really don't want to jeopardize children's education unless there's a really, really good reason to. And we also would be reluctant to have a blanket school closure just because we have some concern, like we expressed here recently, that we suspect there could be disease in the community. So a school closure might be more likely to happen if we're seeing more evidence of local transmission of disease that's documented with test results. And it may even be more focused than that, depending on where those cases popped up, rather than being something that's necessarily system-wide or county-wide.
What do you make of decisions, say, in Ohio, where we've seen the governor say, we're going to close down all schools? What do you make of that?
Well, I was frankly a little bit surprised to hear that, and I do not know all the details that went into that decision. I've been pretty busy lately and haven't even kept up with the entire news cycle other than hearing that the governor had made that decision. There may have been very good reason to do that, but I think we're going to have to think very, very carefully before we do that sort of thing. I cannot tell you that we won't. Things can happen very quickly here, and they have been happening very quickly. So, it could be next week we could be making some new announcement about something like that. It's certainly possible. And if I may add real quickly, we were talking about testing. A lot of testing is coming online, and we're going to see a lot of people getting tested. And so that might mean we have a lot of negative results and we feel a little bit better. And it might mean that, oh my goodness, we're seeing a lot more positive results, and that might push us over the edge.
Well, we want to hear from you as well. What questions do you want to know about coronavirus? How we're responding to it? We're talking about the business implications right now. Send us a message on Facebook or tweet at us at WBHM. You can use the hashtag BigQ. You can also email news@WBHM.org. Anthony Hood, I want to turn to you because we're seeing business impacts. Look at the stock market. That's probably the thing that's most in our face around this. But when we think about Alabama, what sectors are at risk with this outbreak?
Yeah, I think any sector that depends on supplies and equipment from overseas, I think they are preparing for disruptions to their supply chain. So you may see some delays in the delivery of products, particularly in healthcare and our automotive industries.
So you have delays with the supply chain there. It seems to me you also have a demand side as well, as we have events shut down and people's travel are either restricted out of, because they're ordered to or because they just don't want to go anywhere.
Sure, I think when you think about us discouraging events with, hundreds of people attending, those hundreds of people will oftentimes go to a restaurant or go to a bar either before or after that event. So I'm particularly thinking about our service workers and the impact that they may have to those individual employees, but also to the companies.
How big are the margins for these types of business if we think about a retailer or a restaurant that might have some of those lower wage workers that are going to see those impacts, how long could they ride out something like this?
It just all depends. It all depends on their cash reserves. I think the challenge they're going to have is they're employing really good people, but if demand is down, are they going to be forced to, cut shifts? A lot of those service workers depend on tips. So how are they going to, ride this out?
How have you seen businesses preparing over the last few weeks or trying to adapt to the situation?
Yeah, I think it began with, stopping all international travel, and then it went to put a moratorium on domestic travel, or at least having some kind of review by executives as to whether the travel is essential. A lot of companies now, for those employees that can cancel non-essential meetings, they're canceling non-essential meetings. If the meeting is essential, they're encouraging virtual communication, so using Skype, Zoom, and conference call.
I did want to ask specifically about, say, the startup scene in Birmingham, because we think about they need influx of capital, they need venture capital to do what they do. Depending on what we see with the markets, how might that be affected?
Yeah, that's a good question. I don't think they will be affected day by day. Many of them, particularly if they're a tech company, I think the disruption that you may see is from venture capitalists that are outside of Alabama not being able to travel here, or we being able to travel out where they are, out on the coast, typically in Boston and New York, and in the Silicon Valley. So I think that may have some kind of hindrance on the face-to-face communication, but hopefully they will adapt by using the virtual technology.
Yeah, how big a deal is that? When we think of the business world, particularly services or the white-collar world, how important is it to have those face-to-face meetings? Can't we do everything online now?
Yeah, I don't know. I sit in a lot of meetings every day, and I constantly ask myself, was this meeting actually necessary? So I think it is going to challenge a lot of leaders and meeting facilitators as to whether this meeting is essential, or if it's essential, is it essential for people to actually meet face-to-face? And I think a lot of people are going to find that it's really not that essential. I think the other challenge that I would love to bring up, and just to piggyback on Dr. Wilson, what happens if and when schools are closed and you have a lot of people that depend on schools for childcare? So I think there are a lot of employers right now are trying to prepare on how do they continue to support their employees that depend on schools for childcare. And so they need to think about, do we need to give paid time off, or do we need to come up with creative solutions for childcare?
Yeah, Dr. Wilson, I see you nodding your head there.
Well, at the health department, we're not a huge business. We have 430 employees. We've been doing our own planning around that as well, and that was one of the big things was, where do we pull the trigger in terms of having non-essential employees go home or people work from home, and school closing was one of the big ones, so that parents could be at home. So yeah, businesses, it would be a great time for them to prepare for that, and as much as they can, set up their capabilities for people to work from home.
This is The Big Q on your NPR station, 90.3 WBHM Birmingham. I'm Andrew Yeager. We're talking about coronavirus in Alabama. We're talking particularly about the business implications of the outbreak, and helping us with that is Anthony Hood, a UAB business professor, also Dr. Mark Wilson, Jefferson County's health officer. We do have a question from Callie in Birmingham. This is fairly specific, but Dr. Hood, you might have perspective on this. Says, how could SHIPT, which of course is based here in Birmingham, how could SHIPT ensure those who are quarantined and without help get adequate groceries and supplies? I guess there are opportunities business-wise.
Yeah, absolutely. I think some of the concerns that I have about that is there are some SHIPT shoppers, I think, that leave groceries on their front steps. I think there are some that actually bring them into the house, and so I think we need to make sure that we don't turn our delivery people, whether it's SHIPT, whether it's Domino's, whether it's even our Uber drivers, we don't turn them into super transmitters of these diseases. So I think those people in particular are going to have to be very careful about what they touch, who they interact with, and how they go into the homes and go into the stores.
I liked both of your perspective on this question that came in. It said the city of Birmingham today urged healthy people to get out and spend money in restaurants and shops. Does that seem like sound advice right now? I look at the two of you because there's an economic aspect to this, but then there's the public health aspect to it. Maybe Dr. Wilson, how's that strike you?
Yeah, I'm assuming that was Mayor Woodfin, and he actually did call me this morning to talk about that. And this gets back to where we really need to use common sense and do an assessment of your own personal risk. We talked about people with chronic diseases, older people that need to be more careful. But yeah, for younger, healthy people, We don't want all of our restaurants to shut down and things like that, and I don't think that's a necessary measure at this point. But do follow those same basic precautions. Wash your hands frequently. Think about the surfaces you're touching. Wash your hands again, and you might want to avoid situations where it's super crowded and you're shoulder to shoulder with a lot of people for a long time. And there are plenty of venues where you can enjoy a nice dinner or a drink and things are a little bit less crowded, and I think that's very reasonable.
And I think those that can, I think, show some compassion and love to your servers, because they're in a very difficult position right now. So if you can tip them extra, I think now is the time to actually tip them extra. And I think for those service workers who may be experiencing some symptoms, I think they may be under pressure to maybe hide that or delay treatment for obvious reasons, because they depend on these for their livelihood. But hopefully, I think they will. I'm hoping that they will be open and honest about if they start experiencing some type of symptoms.
We were talking about the schools issue and the fact that it's often childcare for people. The other issue with this, another issue with the schools, is that for some students who are food insecure, that's their only place to get a meal, or their primary place to get a meal. Dr. Wilson, as you've communicated with local officials, are there plans underway to deal with that should we have to shut down schools?
Yeah, so we've been in contact with all the school superintendents to help them think about preparedness. And I have heard of some plans. Certainly the Birmingham City Schools superintendent mentioned to me this morning that they're coming up with a plan so that if schools are closed, they can still provide those meals for pickup or some other way for children to get them. But that is a big concern. We also have our community nonprofit organizations. The United Way is prepared to help a lot of people in this situation and have already some contingency plans for these emergencies. Our food bank is a great partner. We have a wonderful community of organizations, volunteers, philanthropy that are very caring and very generous, and I'm confident that we're going to be able to take care of the folks we have in our community.
Anthony Hood, as we think about what likely will be happening over the next few weeks to months, you mentioned supply chains.
Mm-hmm.
You mentioned retail. Those places. What do you? And I realize there's a lot we don't know,
mm-hmm.
but where do you see us taking the hardest hits? What do you think might be less affected by this outbreak?
That's a good question. I mean, like I said, we just don't know. I think we're taking really good precautions to mitigate the spread of this, but I think the next couple of weeks are going to be very uncertain.
Maybe I can ask this a little bit different way. What are the big questions in your mind, business-wise, as you think about how Alabama's economy will be affected?
Mm-hmm. I'm just really thinking about those blue-collar workers, those that can't do virtual meetings, that don't have the liberty like a lot of us do to do our work from home. And I think those industries are service-related, where people actually have to come in, take stuff off of shelves, put them on pallets, things like that. I think those are the people that are going to be impacted, and accordingly, those industries are going to be highly impacted.
We did have a few medical-related questions that came in, and Dr. Wilson, since you're still here, I'll throw them your way. Wendy in Tuscaloosa writes, if you fall ill with the virus, how do you know when you're no longer infectious?
Yeah, that's a good question. We know that people can be infectious for up to 14 days after they've actually acquired the virus. So they definitely need to be no longer having fever. They need to consult with their healthcare provider, sort of give them some advice and make that discussion. I don't have an exact number in terms of how long you have to wait until you've had symptoms, but we do know that it can be transmissible. For the incubation period is about 14 days.
So it's about 14 days, and that's why we're hearing quarantine for 14 days or self-isolating for 14 days. Just a few minutes left here in the program, but we'll remind you that we can still take a question or two if you'd like to pass it along to us. What do you want to know about coronavirus in Alabama, either health-wise or business-wise? Send us a message on Facebook or tweet at us at WBHM with the hashtag BigQ. You can also email news@WBHM.org. We're talking with Dr. Mark Wilson, Jefferson County Health Officer, also Anthony Hood, who's a business professor here at UAB. I'll ask this question. This is a little tongue-in-cheek. I'm sure you've seen the pictures on social media of shelves cleared out at supermarkets as people are trying to stock up, expecting they'll be behind closed doors. Dr. Wilson, is that helpful? Is that really behavior? Is that really what people should be doing?
Yeah, I mean, we're trying to help people not overreact to this situation, and it is a balancing act in terms of being prepared versus being hysterical. And so I think there's some level at which it is reasonable to stock up on things, but it's mainly would be those more vulnerable people that are more likely to be affected in a severe way, who are going to need to self-isolate. My hope is that we will all have a sense of community and not be too self-centered in this whole approach and share a little bit. But it's really hard to alter these behaviors, and we do want people to be prepared. So it's just a really tough one in terms of how we affect people's behavior, because there's guidance from the Centers for Disease Control that is saying, you might want to stock up on a few things. Certainly have your medicines all ready, and things like that, or a plan to be able to get your prescriptions for other things that you need to be treated for. So that's a tricky question. I don't know if Dr. Hood has anything to say about that.
Let me flip that to you, because you have business owners who are seeing their stores emptied out. Mm-hmm. What pressures does that put on them to just keep the shelves full?
Enormous pressure. I mean, because if people are coming in demanding products or services, I mean, that's a sale that you don't have. So it's a good thing to have your shelves wiped out. It's a bad thing to not be able to replenish those. So I think that does encourage those business owners to try to stock up and have reserves, but also, like Mark said, the consumer behavior is such that nobody wants to be without, the necessary supplies. So it's really hard to go against consumer behavior, particularly when people may have a sense of distrust in what they're hearing, from local or national leaders. So I think as long as people trust that the information they're getting is accurate, I think that can calm any kind of panics that may happen.
Well, let me give you the final word here as we wrap up. Business-wise, how concerned should we be as we see the stock market drop and that recession word enter the vocabulary again?
I know people are saying unprecedented, but I think this is unprecedented. We just don't know. In my mind, I'm thinking we're going to say before COVID-19 and after COVID-19. Like, this is going to be a seminal moment, I think, in our world's history.
That's University of Alabama at Birmingham business professor Anthony Hood. Thanks so much for joining us today.
Thank you.
And we've also been hearing this hour from Dr. Mark Wilson, Jefferson County Health Officer. Dr. Wilson, thank you once again.
Thank you.
And thank you to all those who offered up questions. I'm sorry we could only get to some of them. The Big Q was produced by Gigi Duban and myself. We had help from Mary Scott Hodgen, Janae Pierre, Miranda Fulmore, and Michael Crowell. Technical support from Daryl McCullough and Matthew Hancock. Just a programming note, coming up next, we'll have special coverage from NPR News. The White House is expected to make an announcement related to coronavirus. We'll carry that live. I'm Andrew Yeager. Thanks so much for listening, and please, wash your hands.
From NPR News, this is
Okay.
special coverage of President
You've done this
Thank you
before.
very much, and thanks so much for being flexible. We really
Sure.
appreciate it.